Welcome to Module 2. Now that you have a good understanding about how drugs work inside the body, we're going to start talking about the nurse's role when administering medications. In Module 2, we will start talking about how to think like a nurse. Nurses do not simply follow orders written by the healthcare provider. Healthcare providers write the prescriptions, pharmacists fill those prescriptions, but nurses are the last stop before medications are given. It's the nurse's responsibility to make sure that a safe dose was ordered. It's the nurse's responsibility to make sure that clients are not allergic to the medications being administered. It's the nurse's responsibility to monitor the patient's response to the medication. Is the medication working? Is the dose too high? Is the patient experiencing adverse or side effects? How about dangerous, toxic effects? The nurse may need to monitor lab values to see if the medication is affecting those lab values. The nurse must educate the client about the medication, letting the client know what the medication is for, what side effects to watch out for, what they can expect, and most importantly, when to notify the healthcare provider. There's a lot of content in nursing and in pharmacology, so it's important that you begin learning the language. Think about some of the meaning of the stems of some of the words that you'll be learning, such as hyper means excessive, and glucose means sugar. So if you're monitoring for a side effect of hyperglycemia, then you know that you're watching for a high blood sugar. The nurse is going to have to monitor the lab values if that medication causes a hyperglycemia. So you want to think about the stems of all those words, like oto means ear or hearing, nephro means kidney, ocular means eye, and so on. Lastly, be sure that you are utilizing all the resources within the module, such as the Prep U questions. This module, those questions are optional and ungraded, but it is recommended that you take those questions, at least about five at a time, not more, and then check your answers for understanding by remediation. Again, nothing needs to be turned in for this week's module for the Prep U, but it's really good to check your level of understanding. Also, you want to watch the health literacy video, which shows patients that are not understanding their medications that you're on. The video is a little dated, but it's still a very good video. And then the other learning activities, the Quizlet for Module 2, and the adverse effects of drugs and nursing interventions. Thanks. Have a great week.